Hi there, and welcome back. I'd like to continue our discussion of the respiratory system's anatomy with talking about the trachea. Remember, in the last video, we left off talking about the larynx, right? So the first solidly respiratory structure that we've come to. This is right after the laryngopharynx divides um, into the esophagus and the larynx. Okay, so inferior to the larynx, air is going to pass into the trachea. The trachea extends from vertebra C6 to about vertebra T4. So again, we can use uh, our spine as kind of like a yardstick to figure out where these different structures are. Right? The trachea, just like any other modified tube in the body, is composed of three different layers. Okay, so let's just walk through them, working our way from the inside to the outside. Just like with any of these modified tubes, the inner lining consists of some type of epithelium. And the type of epithelium is going to be related to the function of this particular structure. So in the last video, we talked about how the oropharynx is lined with stratified squamous epithelial tissue because we need lots of layers of cheaply made cells because of abrasion by our food. Here we have ciliated pseudostratified epithelial tissue. And so what is going on there? First of all, the cilia are going to be really important. And we can kind of see the cilia right here. They look a little bit like hairs. So the cilia are going to be very important in creating little waves and literally pushing mucus, right? Thus, the layer is called a mucosa. This mucus is produced by goblet cells. And so what it's going to be doing is it's going to trap particulates that have gotten past the mucus lining of your nasal cavity and have gotten all the way down into the trachea. We really, really don't want them to get all the way down into our alveoli or the respiratory component of our lungs. And so we have yet another opportunity to trap any extra stuff and move it out of our respiratory system. Stay tuned for more on that mucus escalator later. So again, this mucosa, which is ciliated pseudostratified epithelial tissue, is lining the entire lumen of the trachea. Okay? Also in this image, we can see that the esophagus is posterior to the trachea. Okay? The submucosa consists of a series of different connective tissues, as well as a muscle, as we can see over here. So let's talk about the connective tissue first. Submucosa literally means under the mucosal layer, and so that's exactly where this is. We can see it in pink. In addition to just having some loose connective tissue, maybe with some glands embedded in there, maybe with some blood vessels embedded in there to feed this epithelial tissue lining, what is really distinctive about the trachea is that it has hyaline cartilage rings. And in fact, if you touch your throat here, you can actually feel all of those ridges, and those ridges are actually the hyaline cartilage rings. Remember that when you exhale, the pressure within your airways is going to drop significantly, and therefore there's less of a force pushing out on those walls. If the trachea was like the esophagus without some kind of structure to hold it open, the tube, the trachea, would simply collapse. And so we absolutely need these hyaline cartilage rings to keep that airway patent or open, regardless of how much pressure is in your respiratory system. Okay. We can see that these rings are not completely round, right? So they're not continuous. It's not a ring itself. They're actually in the shape of a C. And so what is going on with that? Well, it is really important for us to be able to kind of flex these cartilaginous rings for a couple different reasons. First of all, if something does get trapped in these structures or in the trachea, we can actually contract what is called the trachealis muscle to facilitate coughing and kind of pushing whatever that substance is up and out of our respiratory system. Right? So we need to make sure that we can flex and therefore push up anything that happens to get stuck. Right, so part of the cough reflex. The other reason why we don't have continuous rings, they're just a C shape, is that Maybe if you take too big of a bite of a hamburger, the esophagus can actually squeeze its way into the space of the trachea just a little bit. And of course, you can feel it going down. It's not necessarily comfortable, but it is possible. So you don't get food stuck there in your esophagus. Okay, so in the middle layer of this three-layered modified tube of the trachea, we get these very specific specialized structures, the hyaline cartilage C-shaped rings to keep the airway open. And on the posterior side, we have the trachealis muscle, which facilitates the cough reflex. And the esophagus can temporarily extend into part of the trachea. Finally, all the way on the outside, we have adventitia. So this term is just referring to the fact that this is a layer of connective tissue that is kind of stabilizing the trachea right where we need it to be. Okay, so this is some histology for you. My favorite tissue to look at, actually, if supposed to have one, here is the opening of the trachea, the lumen of the trachea, so where your air would be. Note that this is pseudostratified columnar epithelial tissue. We can see the little cilia up here in the like fuchsia color. We can see lots of nuclei kind of stacked on top of each other, implying that this is pseudostratified. And not really obvious in this particular section, but you can also often see these big open goblet cells that are constantly secreting mucus. Right? So very important to the to the function of this tissue. So this purple layer here is the mucosa layer. Next, we have the submucosa layer. So we can see that there are some blood vessels in here. We can see lots of connective tissue. And then finally, after the submucosa, we have the adventitia, which is just a series of connective tissue, oftentimes also with some loose adipose connective tissue as well. And so what we can see in most of this picture, and his histological picture is that most of the thickness of the wall of the trachea is actually hyaline cartilage. And so we can see the little chondrocytes and their lacunae. This kind of smooth purple texture here is the cartilage itself. Okay, so just as a reminder, here is the larynx. The cartilage in the larynx is not in the shape of a C. Each of the cartilages have a very unique structure and therefore a unique name. After air passes through the larynx, it will enter into the trachea with those C-shaped cartilaginous rings all the way down until this next funny shaped cartilaginous structure, which happens to be supporting and strengthening this branching event. The trachea is going to divide into two, and these two branches here are going to deliver air to the left and to the right lung accordingly. Okay, so there is a name for this specialized, weirdly shaped cartilage here. And that is called the carina. It is the last tracheal cartilage. And again, it just needs to be a little bit different so that it can support and strengthen this joint between the trachea and its two first branches into each of the lungs. Now, the carina isn't just important anatomically, it also has a very important function as well. The carina is equipped with the strongest cough reflex we have of any different structure within our respiratory system. And the reason for that is that after the trachea splits, essentially, so after the carina, these airways are much smaller than the trachea. And so if you swallow that bite of hamburger, right? And you happen to be talking while you are chewing and that piece of hamburger goes down the wrong tube, it might be able to get pretty far in the trachea without actually hindering your breathing. However, if it makes its way past the carina, even a tiny chunk of hamburger is going to completely block the airflow to this entire lung. And so the carina is equipped with this really strong cough reflex to make sure that nothing gets down that far. And so you would cough most aggressively if something makes it down all the way to the bottom of your trachea. Okay, so after the carina, as I said, the trachea is branched into two, one branch going into the left lung, one branch going into the right lung. The branches are named according to what order they are in, right? So this first branching event, we get to primary airways. The two primary airways branch into secondary, the secondary branch into tertiary, and so on and so forth. And so this happens 23 times. Essentially, the goal here is to increase the surface area as much as possible, to have as many airways as we can possibly fit in the lungs, so that we have more opportunities for oxygen to cross over our respiratory membranes into our blood and carbon dioxide to pass out of our blood and into these airways so that we can exhale it. Okay. In general, this branching pattern is called the respiratory tree or the bronchial tree, and we can see it kind of looks like roots in the ground, or if we flip it over, the branches on a tree. Most of these branches are called bronchi. Bronchi up here with an I at the end, that is plural. Bronchus is singular. And so just to walk through this really briefly, left and right primary bronchus. We'll see in the next video that, of course, there's a second name for these. Secondary bronchi, or this is a secondary bronchus for singular, and tertiary bronchus / bronchi for plural, and so on and so forth. In this class, we're only really going to be focusing and naming the first three orders of branching. Now, if we zoom all the way to the very end, we call these airways bronchioles or bronchioles, depending on who you are. Both are okay for me as long as you can spell it. Okay, so in the next video, we're going to talk about how the wall of these airways changes as we get deeper and deeper into the lungs. Thanks.